Hello everyone. Today in this video we will be talking about difference between placenta previa and abruptio placenta, one of the frequently asked question, and it is these two are one of the important differential diagnosis of antepartum hemorrhage. So how can we differentiate between these two conditions is that by first of all by looking at the clinical picture. In placenta previa, the nature of bleeding is painless. There is painless bleeding and apparently causeless, and bleeding is recurrent. Apparent painless, causeless, and recurrent, and the bleeding is always revealed. We can see the bleeding. Bleeding is conspicuous. And there is the bleeding. We can see the bleeding coming out from the vaginal canal if we examine. And in abruptio placenta, the bleeding is painful. Often it is attributed to preeclampsia or trauma, and the bleeding is continuous type. And it is the bleeding might and abruptio placenta, the bleeding might be revealed, concealed, or usually mixed. In revealed, we can see the bleeding. In concealed, we cannot see the bleeding from outside, but internally the bleeding is there, and or it may be a mixed variety. In placenta previa, the blood is bright red in color, whereas in abruptio placenta, the bleeding is dark red. The blood is dark red in color. Dark color. Here, the general condition and anemia is proportionate to visible blood loss, and in the abruptio placenta, the general condition and anemia is out of proportion to visible blood loss in concealed or mixed variety. But in revealed variety, it is same as that of placenta previa. It is proportionate with visible blood loss, but in concealed and mixed type, the general condition and anemia is out of proportion to the visible blood loss, especially in the mixed variety. In concealed, we cannot see the visible blood loss, but in mixed type, the bleeding is very scanty, and in the anemia is out of proportionate with the visible blood loss. Why? Because there has been bleeding is in the internally, but even though we cannot see from outside, there has been bleeding inside, and that causes the symptoms of anemia, and the symptom is more compared with the visible blood loss. And the feature of preeclampsia is not relevant in the placenta previa, but it is present in 1/3 case of the abruptio placenta. And on examination, we can see that height of fundus is proportionate with the height to the gestational age, and the uterine size is equal to the gestational age, and it may be disproportionately enlarged in concealed type. Again, it is done in concealed, not in the revealed. In revealed type, it is same as that of placenta previa. In the concealed variety, the height of uterus is more enlarged and as compared to the is non corresponding gestational age. And in the feel of the uterus is soft and relaxed, whereas the uterus tense, tender, or rigid in abruptio placenta. The malpresentation is very common in placenta previa. We can see the breech presentation or transverse lie, whereas head is high floating, whereas the malpresentation is not related with abruptio placenta. The head might be engaged. And in the fetal heart sound, it is usually present, and the fetal heart sound is usually absent, especially in the concealed type. And in the placentography, the placenta is present in the lower segment, and the placenta is upper segment in abruptio placenta. And in vaginal examination, the vaginal examination is we can see it is in the lower segment, and we should not do it in the suspected case. And the placenta is not filled in the lower segment, and placenta is not filled in lower segment in abruptio placenta. So that was all about difference between placenta previa and abruptio placenta. So go back to the basic definition. What is the placenta previa? When the placenta is implanted partially or completely over the lower uterine segment, and over or adjacent to internal os, then it is called as placenta previa. Whereas in abruptio placenta, it is the condition where the bleeding is occurred due to premature separation of normally situated placenta. Here the placenta is normally situated. Here the placenta is abnormally situated in the lower uterine segment. That is the main basic difference between these two. So thank you, and it was all about abruptio placenta and placenta previa, the difference, and it is very important, frequently asked question in MBBS final year theory as well as both in Viva and the bedside round. Thank you, and keep learning, and we will meet you again in next video on obstetrics. Thank you.